Hello and welcome back to Grow, Gold Star's Resource and Opportunities Workshop. Once again, I'm Ford Chumley, and tonight I'm joined by a very special guest. Taylor Beard is the Community Relations Representative with Team Select Home Care, an organization dedicated to providing solutions to local communities that innovate the home health space. He's here tonight to discuss the Family CNA program offered through Team Select. So without further ado, here's Taylor.
Hello everyone, and thank you so much for joining us, and thank you to Gold Star for inviting me and having me here. As Ford mentioned, I'm the Community Relations Representative for Team Select. Team Select has a number of different programs, but the one that I would like to discuss today is our Family Caregiver Program. So in a nutshell, what we do is we get family, friends, loved ones trained and paid to take care of special needs, someone, family, friend. So a lot of our patients have a child that has some kind of medical fragility and need kind of a daily caregiver. And what we do is we train a family member to become a certified nurse's assistant that ends up actually getting paid for that care. So a few things about the program. There are a few qualifiers that have to be met initially. So the patients must be on Medicaid. This is Colorado State Medicaid. We deal with a number of waivers for children as well. They must have a long-term medical diagnosis. This has to have some documentation from a physician or a doctor that we can actually see. So it has to be supported clinically. And then third, it has to require a daily skilled hands-on care. So the three things that you need to have Medicaid, a long-term diagnosis, and then it must require daily hands-on care. So how does this all happen? So a lot of times we get word of mouth referrals. So we work with a lot of support groups that families on Facebook, they say, oh, I've heard of the Parent CNA program. How does this all work? So it works by you just give us a call and we kind of dig up some medical documentation to figure out that first piece. So for example, let's say a family has a child that has cerebral palsy and the mom is not really able to work because she has to do a lot for the child throughout the day. So they would talk to us, we would look at some medical documentation and send a nurse out to the home. What we do is we want to see how many activities of daily living are really being provided by the mom or the caregiver. So these would be things like, does someone need help putting on their clothes? Does someone need help bathing, personal grooming? Do they need help eating? These type of things, pretty much any of the things that you're going to be doing on a day-to-day basis from the time that you get up to the time that you go to bed. So a nurse goes out and what they have is a tool that Medicaid provides, and it's called the Pediatric Assessment Tool, and that's for pediatrics. And if it's an adult, it's called an Adult Assessment Tool. So a nurse would run through kind of everything that a family is doing for a loved one and ends up getting a score. So they would ask questions similar to what I was saying, like, what are you doing in the mornings? Is this person independent with this? And there's a minimum threshold score that Medicaid requires to qualify for the program. So not everyone will qualify for the program, but if you do qualify, you're assigned a number of hours based on that score, the assessment that the nurse does with you. So this could be anything from 2 hours a day for a case that we would consider on the light end to 8 hours of care a day. And this is 7 days a week. So if you get qualified for any number of hours, that qualifies as daily hours. So if someone qualifies for 5 hours a day, they would get 35 paid hours of care for their loved ones every week. And it's fairly simple. Once someone qualifies for the program, they become an employee of Team Select Home Care. So it would be like a nurse working for a nursing agency, but it's a certified nurse assistant working for a home health agency. So they would come to orientation, essentially, like I said, become an employee of Team Select and go through an orientation. and then we would give them a tablet. And just like an iPad or like an Android tablet, and essentially what the families are doing is just logging the daily tasks that they're completing. So that turns into their job. So a lot of these families, like I said earlier, have a really hard time, either a parent or a spouse, going out and having a normal 9 to 5 job because they are at home taking care of a loved one. So now we've kind of helped in a few different ways. We've gotten the patient, the loved one, the care they need. It's being provided by a family member who knows so much more about the needs of their loved one than, say, an outside agency. And we're also providing employment to that individual, which is great because a lot of these families and caregivers are not able to work a normal 9 to 5 job. So really what we've done is, taken someone, I mean, it can be life-changing. I've had people come up to me and say, I finally got to buy my first car because I'm not having to, live off welfare checks or, other means, or, my husband is working around the clock because I can't work and I have to take care of my loved ones. So the program really can be life-changing for a lot of these families. I've been talking about pediatrics a lot, and that is a lot of our business comes from parents that are taking care of their children. But it also applies to the adult world as well. So it's not age specific. So we do have a lot of spouses, things like I've seen people that unfortunately have had a stroke or some kind of debilitating thing where they're needing to be transferred in the morning, they're needing help ambulating. All of these things would help qualify for the program. But like I said, Medicaid is a prerequisite. So we do not work with the DD waiver for adults, which I know a lot of adults are on, but that waiver does preclude you from qualifying for the program. As far as the children, we work with the CES waiver, we work with straight state Medicaid. If you're on the IHSS waiver, you can kind of do the IHSS program, but you can't do the parent CNA. It's kind of a one or the other type thing. And that is kind of just essentially in a nutshell what we do. We train family members or loved ones to become certified nurses assistants to give care in the home and get compensated for that. I will mention the CNA program because I didn't really touch on that. The way that looks is Team Select pays for everything as far as the schooling. So there's zero out of pocket to the families. Team Select pays for all of the school. The school can look kind of however you want. We work with most of the schools in the area. If you're affiliated with Gold Star, we have a school that is very, very close by. It's on 84th and I-25 over by the Regis building, which is super cool. But like I said, there's options. So we work with most of the CNA schools in the metro area. So you can kind of pick one that's close, or there's online options. A lot of these families that would qualify for the program can't just take a bunch of time off and go to an in-person learning. So there are online options as well. If you do an in-person learning, you can get this program, the CNA school, done in as little as 2 to 3 weeks, depending on how quickly you want to go through it. If it's something where you want to kind of pace it out a little more because time is precious and a lot of people are at home with their families, you can do a self-paced program. So really, if you want to get it done fast, you absolutely can. If that's not super convenient for you, you're able to kind of space it out over a longer time. But everything is taken care of by Team Select up front. And then once you pass and get your CNA certificate, you become an employee of Team Select and you start making money for caring for your loved one. It's a really great program. I wanted to work with this program specifically. I had worked with adult home health before, but seeing the impact that this has on the families and seeing the community that we've built and the culture here, I really wanted to make the switch. And I've been doing this since November, and we've helped so many families. And it's a job for me, but it's a job with a purpose that I really love. And being able to help these families is extremely rewarding. Ford, should we open it up for questions at this point, if there are any?
Absolutely, yes. Let me go ahead and join you here. Please, if you have any questions for Taylor, go ahead and type them into the chat. Or if you'd rather, join in the discussion, go ahead and unmute yourself and just go ahead. We're gonna have this as an open Q&A session. So please feel free to ask away.
Chad, can you hear me? Chad, can you hear me?
I can hear
Or do
you.
you have any questions?
I don't. I think
Okay.
that was extremely informative. And if there aren't any questions, we're going to go ahead and wrap this up. But I'll leave a couple more seconds here just in case anyone's trying to formulate a question or type one out.
Somebody's asking a question. I don't know why we can't hear them. Raphael is.
So sorry. Maybe. So it seems like I'm having an audio problem with my computer. Rachel just ran over. Thank you, Rachel, to let me know. Here, I'll tell you what. Let me.
All right, let's try it again. Can you hear me?
This. If I unmute here. Is it Eugene who's trying to ask the question?
Well, yeah, Raphael was trying as well.
Oh, I'm seeing a question from Ashley Vihill.
Okay.
So we can start with that. So Ashley is asking in the chat, is there paperwork that must fill out to get started? And the answer is really no. So what we do on the initial reach out is just get the individual that is needing the care. We get a name and a date of birth. And then we can pull medical documentation, either from like a primary care doctor, or if they're a pediatric, there's a children's database. So we really just need consents to pull medical documentation. Nothing needs to be signed on the front end. Pretty much just a name and a date of birth is all we need to get started.
Okay.
Okay, so Raphael, I'm so sorry. Go ahead and ask your question. We just had the computers muted here, but please go ahead.
Okay, I'm seeing Raphael typed out the question, says I may have cut out when I was talking about the DD waiver. So unfortunately, the DD waiver excludes people from the parent CNA program. So if you are on the DD waiver or know someone that is, you cannot do the parent CNA program with that waiver. It's unfortunate, but it's just the way that the Medicaid works. If you're an adult, straight state Medicaid works. The DD waiver, unfortunately, is one of the only ones that we do not work with.
Okay, can you hear me now?
Yeah, we got you now, definitely.
Okay, so my son, I believe he's on the DD waiver and Medicaid.
Okay.
Okay, so I'm sorry, so it still excludes it?
Unfortunately, if they're on the DD waiver at this time, they're not, they cannot receive the parent CNA services as well.
Okay.
Okay, great. Thank you, Raphael, for your question. And again, sorry about the technical difficulties. We had both the computers muted, and we just needed one of them muted. So thank you. Thank you again, Raphael. I see that Eugene, you've unmuted yourself. Did you have a question as well?
Yes. So I just had a reassessment with Rocky Mountain Human Services, and we went through almost all these questions and stuff that you brought up in the thing. Plus, I also have her primary care doctor. There's no issues with, getting a thing, but would it be helpful to add that thing from Rocky Mountain Human Services? Because, I mean, it went through all that stuff, and I do all that stuff for my daughter, and it's already printed out.
Okay, yeah. I mean, if this is something that you're interested in, it's very easy for us to pull documentation. If you already have it, like that is great. Okay, perfect. Yeah, I mean, to get things started, really, we just need probably what you already have. And then typically, if it looks like there's a qualifying diagnosis, we would send a nurse out to the home and then see how many hours that you may qualify for.
Okay. So, but to do it, I have to go through the CNA process then?
Yep, that is correct. So, and like I said, you can kind of do it however you want. There's like a 3-week course, there's online courses, but you do have to be a CNA to qualify for the program. But everything is taken care of financially by Team Select, so there isn't any commitment from you all on the front end. And you're not committed to anything at any point, even if you left school.
Because I'd probably like to do it online.
Okay, absolutely. Yeah, ton of good options.
And the delegates go to Gold Star 5 days a week. So I have.
Okay.
In order to do that, but I've been taking care of her for 12 solid years. You know,
Okay, wow.
baby, feeding, you name it.
Okay.
I do it every day.
Wow. Well, good for you. That is awesome. And yeah, I'd love to get in touch with you. I think I could probably get some information after the call and probably touch base with you tomorrow morning. I also want to address a question that was on the chat that said, which company is this through? And this is through Team Select. So one of the requirements for the program is that the CNA must work for a Colorado certified home health agency. So the parent CNA program that we offer is through Team Select. There are other companies that offer the program as well. But this is I work for Team Select, and that is our offering.
All right, great. Thank you all so much for your questions. Are there any other questions? I'd like to keep this open if anyone's coming up with a question.
Taylor, are you the go-to person for them to contact if they want to look into more about Team Select and CNA home care?
Yeah, absolutely. I'm a great first contact for you. My role is essentially getting families going into the process. So I'm a great first contact, and I can help walk you through the entire way.
Perfect. I'm going to put your email information in the chat so everybody has it.
Awesome. Thank you, Rachel.
All right, very good. Thank you, Rachel. Have we answered everyone's questions? I just want to double check before we call it quits on this wonderful presentation.
Well, Eugene, what's the best way to get in touch with you?
Probably through an email or phone number.
Okay. Yeah, if you can you see the chat? Rachel put my email up in the chat, and if you shoot me an email, I'd love to speak with you tomorrow.
Okay. Okay, so I can just put it in the chat.
Yeah, Eugene, if you go down to the bottom of the screen, there should be a little button down there that says chat, and if you click on that, you should be able to see it.
Yeah. To every and then type a message here. So is that where I can put my email?
Eugene, I can also share your email with Taylor as well. I have your email.
That'd be great, Rachel.
Okay.
Got
Awesome.
you, Eugene.
Yeah, that works out great.
Now I think we have one more question from Emily.
Yeah, so I'm reading this. Emily is asking, I'm curious about the benefits and what qualifies as CNA stuff that we can bill for. What we're really looking for is the daily hands-on tasks that have to do with activities of daily living. There are a number of different things that can qualify for the program, but there first has to be a long-term medical diagnosis. So we have to have something that's been diagnosed by a doctor. This can be any number of conditions, and we kind of take them on a case-by-case basis. But if there's a family or someone in need that is requiring daily hands-on care, those are the type of things that typically will help get you qualified. Things like I said this earlier, like getting dressed, helping with personal hygiene, eating. It can be anything from transferring if someone has mobility issues, anything that's going to require someone else's help to kind of get through the day can potentially be a qualifier. So Emily says, oh my gosh, let me pull this up. Does watching them so they don't smear feces or meltdown or runaway count? It can. A lot of what Medicaid is approving is going to be things that have a diagnosed physical disability, and that can be in addition to like a behavioral. If there's something behavioral, the behavioral part, such as something like autism, isn't like an automatic qualifier. Typically, they're looking to have something else as well. And that can be anything from mobility, even if I've had patients qualify that have autism, that have like a skin condition that requires like a prescription medicine. There has to be some element of it that isn't completely behavioral to qualify. We do have a good number of people on service with us that do have autism as a primary diagnosis. Most of those have a secondary diagnosis as well. So the autism or a behavioral diagnosis can work, it just cannot stand alone. And I wish the law wasn't written that way into Medicaid, but unfortunately that is the case currently.
All right. Very good. Thank you everyone again so much for the input and the discussion. I'm sure these questions are helpful for everybody. Let's see, does anyone else have any questions?
Well, yeah, so for her Medicaid, if she has a Medicaid card with a member ID and all that stuff, is that all you need, or do you need to talk to Medicaid?
I mean, if you had that, we could definitely work off that to get started. That is plenty just for us to kind of get the ball rolling. Absolutely. And thank you so much for everyone's engagement in this. This has made it a lot easier on me to be helping answer questions than just rolling solo the whole time. So really appreciate all the feedback. This has been really good.
Yes, thank you, Eugene, and thank you everyone else for engaging and asking questions. Taylor, thank you again so much. I really appreciate it. And if there are no other questions, we're going to go ahead and wrap this up. But I just want to make sure that everyone remembers that we have recorded this call and recorded Taylor's presentation. It'll be made available through Gold Star's Resource and Opportunities Workshop Facebook page. If you're not following the page already, please do so. All you need to do is go onto Facebook and find Gold Star Learning Options, and there will be a link there to this new workshop that we've created. So once again, I'm Ford Chumley, and this has been Gold Star's Resource and Opportunities Workshop. And I want to thank Taylor again so much for joining us today. And thank you all so much for joining in and asking these great questions and engaging with us. And just be on the lookout for more resources and the links to the YouTube video of this presentation on the page itself. And if that's it, we're just going to go ahead and say goodbye. So thank you again, everybody, so much. Have a great night.